Oral Health Part 2, Aligning the CDC's Strategic Plan with the Goals of Healthy People 2020. Now that we understand what the CDC's Oral Health Strategic Plan is and how it will tackle the nation's top oral health concerns, let's take a look at how these goals align with the objectives of Healthy People 2020. For those of you who don't know, Healthy People 2020 is a government program developed through the United States Office of Disease Prevention and Health Promotion. Healthy People releases health objectives and plans every 10 years. The latest agenda, Healthy People 2020, was released in 2010. The goals of Healthy People 2020 are simple: to identify health priorities nationwide, to increase public awareness, provide measurable goals, strengthen policies and improve practices, and to identify critical research needs. In accomplishing these goals, Healthy People 2020 hopes to actualize their vision of creating a society in which all people live long, healthy lives. Now that we know what Healthy People 2020 is about in general, let's talk about the goals of Healthy People in regards to oral health specifically. There are three main objectives when it comes to oral health: to increase awareness of the importance of oral health, to increase acceptance and use of preventative measures, and to decrease disparities in access to oral health care. Does any of this sound familiar? It should. As you can see, the objectives of Healthy People 2020 Oral Health Plan are strikingly similar to the goals outlined in the CDC's 2011 to 2014 Oral Health Strategic Plan. This, I assure you, is no coincidence. Let's take a closer look at one of the goals in particular. We already said that one of the goals of Healthy People 2020 is to decrease disparities or inequalities in access to oral health care. The CDC plans to address this issue by broadening the understanding of health disparities, examining the detriments of health disparities, and by using evidence-based approaches when implementing interventions. By broadening our understanding of why these disparities exist, we can more effectively prevent them from happening. By using evidence-based interventions, we have a more realistic chance of closing the gap in these health disparities. But how do we do this? Well, the CDC's strategic plan calls for continued focus on oral diseases and those receiving preventative measures. More importantly, the plan calls for oral health education. That is, by educating public healthcare workers, dental care professionals, and policymakers on health disparities that still exist within our society and why those disparities are an issue of public concern, we can better motivate others to address the issue within their local communities and government. By talking about this issue and informing people about the inequalities within our oral healthcare system, we can bring national attention to it and work towards abolishing health disparities for good. As you can see, there are many parallels between the CDC's Oral Health Strategic Plan and the oral health objectives listed in Healthy People 2020 initiative. The strategies outlined in the strategic plan will have a profound effect on national oral health and will indeed actualize the goals of Healthy People. Because these two initiatives align, they are supportive of each other, and the success of one will mean the success of the other. Together, these programs and the hardworking people executing each step will accomplish the mission, and the vision where people live long, happy, and healthy lives will soon be a reality.